Wonderful. So I would like to thank everyone for joining us this evening for the Migraine Masterclass with Dr. Bob Sheeler. My name is Michele Drielick. I am also, I have a master's in nutrition, and I've worked with Dr. Sheeler on the Migraine Masterclass, and I'm also the co-founder of DestinyWell. So this evening's topic is breaking free from migraines. You saw the discover and reverse the root cause of your migraines. This was the emails that we've been sending out. And what this evening is all about is a systematic approach to identifying the root causes of your migraines so that you can properly address your migraines. So Dr. Sheeler is joining us. He's going to give a part of the presentation all about root causes and the implications and what they mean for your health. Dr. Sheeler actually has a stellar career in medicine. He is boarded and certified in more specialties than any physician I've ever worked with. He's boarded and certified in family medicine, functional medicine, and integrative medicine, and there's a whole list of other things. He is a migraine expert, and he actually ran a migraine headache clinic at the Mayo Clinic. And so he's known as the migraine guy among his peers. So we're really excited to have him here, and we're excited that he's been so instrumental in researching migraines and identifying a solution for migraines. So if there's nothing else, hopefully by now, everyone on the call has taken the migraine subtype quiz. If you haven't, that's fine. Now it would not be the time to take it, but we strongly encourage you after this call to go ahead and switch over and take the quiz, and everything that you've learned will make a whole lot of sense when you can apply it to your specific type of migraine. And so this evening, we're going to, if I would say this, if there's one takeaway from this, it is this: the root cause of your migraine, just like any other chronic condition, no matter what it is, heart disease, diabetes, the root cause of it is directly related to finding the solution and reversing it. So that's the biggest takeaway that you can have here today. And we're going to walk through this and learn all about it together. So I do want everyone to know that at the end of the presentation, we have a very special bonus that has to do with food sensitivities and food sensitivity testing. And so I'll describe this in more detail at the very end of the presentation, but I think it's something you're going to find very interesting. But as we dive in, I just want, it gets kind of lonely here behind the screen, and Dr. Sheeler and I, we love to see people interacting, so feel free to post chats, questions, and we'll get to them. But right now, take a minute and think of all the things you've tried to resolve your migraines or even just get some relief for a while. Think of all the things you've tried, and in one word or a couple words, go ahead and type into chat the kinds of things you've tried. It could be the number of medications you've tried. It could be various different modalities. I will say this: there is not a single silly or stupid answer. People sometimes are shy about putting it out there, but there are lots of remedies out there that people have looked for. So we've got it up there.
I see lots of things. So Luna has used dietary changes, and that's foundational to our approach. See a lot of the common medicines that we recognize, as well as supplements, chiropractic. Alexis said peppermint, and so we use that in some of our remedies, both the oral peppermint for some things, but especially the aromatherapy. We have an aspect of that.
Neti pot, I love that. That's great.
I see Nancy and several of you have used Excedrin, and I used that for years and gotten a little bit of trouble with it because it eventually caused me rebound headaches. And so we're going to talk about the role of all the common medicines. When they work, they're great. And when you get more frequent or more intense headaches, sometimes they start out helping and then end up digging the hole a little deeper. So thank you for sharing all that.
I see feverfew as well. So for those of you who have tried feverfew, keep that in the back of your mind when we get to the rebound discussion. That's great. teas, meditation, yoga. So Lisa, Abby, Victoria, Star, lots of different things out there. Terrific. Okay. So this is so helpful because hopefully what this shows you is that you're not alone, right? There's just a need to get to the problem and actually find different things, try different things, and try different ways to unlock the combination. What this says to us, looking over all the wonderful responses that are coming in and all the varied responses that are coming in, is that you haven't given up, right? You continue to try, and that's so important in finding the solution to your migraines. The other thing that you're probably noticing is that you probably have had friends that they might say magnesium works for them, and then in other friends, it doesn't work, or vice versa. And so the whole idea is that something works for everyone, right? But until you understand the root cause, it's really just hunting and pecking and shooting in the dark. So these have been helpful. Thank you so much. So I just want you to know, we kind of jotted down a few of the things that we hear overwhelmingly for people as to why they show up in droves for these presentations, right? So these are things that you probably share in common with folks that come to these presentations. You or someone you love, this is kind of an obvious one, you regularly suffer from migraine headaches. You probably feel like you've tried everything to get control of them, right? So again, if we look through the list, there's a lot of different solutions that people have tried, or a lot of different remedies that people have tried. It's a commonality, I think, that ties folks that suffer from migraines together. You likely want to avoid a lifelong dependency on medication. Medication is great. It has its place for some, but the idea of being dependent on medication is kind of unattractive for folks through the rest of their lives. And then you probably have realized that it's not fair, right? You shouldn't have to live like this. There's got to be a combination that will click that can relieve you of this burden. And we completely understand that. We've been working with folks with migraine for quite a while, Dr. Sheeler, over 20 years. But the most enlightening and exciting thing, and something that everyone should kind of honor in themselves right now, is that you obviously believe that there is a path to migraine freedom. Because frankly, there are a lot of folks out there with migraine that have given up. A lot of folks that are just hopeless. And so the fact that you continue to try things is evidence to yourself that you believe that there is a path. And so this is so exciting because what we're going to talk about tonight is Dr. Sheeler's path. So it's so great to have you here with us. So the only thing that I want to say as we dive in, and I'm going to hand it over to Dr. Sheeler in a minute, is come into this presentation with that same open mind that what if this time it is different, right? You may have taken the subtype quiz. You may have seen things that totally were shocking to you, or you may have seen things that you may have already known, like maybe you already know you have a thyroid condition. Understand that understanding subtypes is really the first step, but it's the key. And once you take that first step and understand your subtype, what follows is the absolute direct customized path that you need to be on. So really, we're talking about treating the cause, not the effect of your migraine. Medication works, but it's treating the effect, right? So the root cause dictates that path to reversal, which is so exciting because there's a path. So what we're here tonight to do is actually help you understand what these root causes could be and how they can help you on the path. Through his work, and Dr. Sheeler will describe his extensive trial and error and failing and succeeding and research that led him to the understanding that aside from the types of migraines you've all heard about from your doctors, there are these 9 or 10 underlying subtypes that actually dictate the root cause of your migraine. And so hold on to that because this is pretty exciting where we're going. So without further ado, Dr. Sheeler. I like to call him the brains of the migraine. So he actually devised this whole system, and he's going to share with us how he went about doing that right now.
Great. Well, thank you so much. Delighted to have you all here. And I want to share with you things that I've distilled from 20 years of migraine practice. Patterns of headache symptoms and constellations that go along with different aspects of headache that lead to treatable root causes. Things we can treat that'll actually make your headaches go away or come under great control, rather than just labels we can give them and then give everyone the same medicines. So let's start with this here. Okay, so I come by migraines honestly. This is my grandmother's birth certificate. She was born in the 1890s. Back then they didn't have migraines, they had sick headaches. And people with sick headaches would go in, they'd get sick to their stomach, they'd have nausea and vomiting, they'd go in a dark room and curl up for 2 or 3 days. Well, migraines last 4 to 72 hours. So she obviously had the bad end of migraines. She also had asthma that is comorbid and goes along with migraines. So people who have migraine are more likely to have asthma. Back then, the only treatment that was available that helped those things was morphine. And so she was one tough lady. She'd take morphine until she broke the cycle of her headaches or until her asthma got better, and then she'd cold turkey herself off of it over and over again. My migraine lineage then goes to my dad, who was a sweet, wonderful person, and he also had migraines, and he suffered with his migraines well into his 70s. It slowed him down in terms of making him feel bad. He still actually spoke 7 languages and wrote over 100 textbooks to teach foreign students English. And so he had an illustrious career, but it was sad to see him suffering a lot. And then this is me before I knew what migraines were. And then this is me in my early pre-med years when I was completing elementary school. Because apparently you have to finish elementary school, then junior high, then high school before you can go to medical school. So I worked my way through all of those different aspects. I had a slight diversion as I studied magic, and this was me doing a magic show at our elementary school with my lovely assistant, Bob Clark, who was my best friend at the time. But I went back to medicine. The draw was irresistible because I liked that whole being integral to people's lives, blending and understanding the science and making it available to people so they would understand their choices and be able to go from there. So the first thing that I studied was family medicine because I liked adults and kids, and I wanted to be able to practice in both urban and rural areas. So I became a family medicine specialist. I'm board certified in family medicine, and you draw to you the kinds of patients that interest you. So since I had migraines, my migraines started when I was around 19. I didn't really know what they were. Through college, I kind of put up with them and took basic headache, analgesics, ibuprofen, and Tylenol and Excedrin type stuff. But I was always interested in headaches because I had them and people knew that I cared about them, so they'd come to see me and my friends would ask me questions. And then I was always interested in high blood pressure. And during the years I was at Mayo, when they were keeping track of this, in our department I always had the highest rate of blood pressure under control because I would work with the folks and be very meticulous. And that's what I brought to this headache realm as well, is being very meticulous, trying to study all the aspects and understand the look and feel of headaches and what gets them better. So I was able to study headaches. I spent a lot of my trip and travel time going to headache meetings. I would read headache books and I got headache journals. I joined several different national headache societies here in America. And I even joined the International Headache Society. I presented and lectured locally. I did headache research. And I also was able to go different places to study headaches. So I was able to study in Stockholm. This is me out in front of the Nobel Museum. And I was able to study in Japan. So here I am in Kyoto, increasing my omega-3 fatty acids at a sushi bar, but also going to the International Headache Society Museum. And I saw a chat that one person was seeing just a blank screen. Maybe we should confirm with the folks in general that most people are seeing the screens here. So if you could send us a chat and let us know, that would be good. Okay, so folks can see. So after I studied and I was able to take the headache boards, I became a certified subspecialist in headache medicine through the United Council of Neurologic Subspecialists. So that's the same body that if you're a neurologist and you have interest in headaches and you want to get certified, it's the UCNS that certifies you. So I did that, and once I did that, I felt like, okay, now I really have the tools. I understand all the medicines, I understand the approaches, I know who needs a CAT scan, I know what needs to be done. And I was allowed to start my own headache clinic at Mayo. I saw a lot of local patients, a lot of employees, but I also saw patients from around the country and some international referrals as well. And I felt like I'm here and I'm ready to help people with headaches. I did all the other things you're supposed to do in your career. I had wonderful opportunities at Mayo. I got to teach in the medical school. I got to run task forces. I was the medical editor of the Mayo Clinic Health Letter for almost 20 years, and I brought in a lot of complementary and alternative medicine things as well to there. And I published in some of the main journals that you've heard of, the New England Journal, JAMA, the Mayo Clinic Proceedings, also in headache journals. And so I was doing all the things you're supposed to do in your career. But I felt like I was a success because patients liked me as a headache doctor and they knew I cared, and a few of them got better. But I also felt like I was a failure because lots of people didn't get better, and some of them gave up and quit coming. And my own migraines during that time were still very frequent and disabling. They really slowed me down, and I was working long days, sometimes 18 or 20-hour days. And so I used to joke that my research time at Mayo was between midnight and 4 a.m. That was after I finished all my patient care and charting, and I wish that was a joke. And so in headache medicine, it turns out that the literature and the research is that if 50% of people who try a new drug or treatment get half better, they get 50% improvement, that's considered success with a new headache treatment. And so I got to thinking about the other things we treat in family medicine, like strep throat or pneumonia. And so I was thinking, okay, I've had pneumonia before. If I went to my doctor and I had pneumonia and I said, hey, I've got pneumonia, what can you do for me? And they say, well, we've got a drug that's got a 50% chance of getting you half better. I go, okay, like what else you got, or who else should I see? Because that's really not what I'm looking for is a 50% chance of getting half better. So even expensive drugs like Botox barely beat placebo. If you look at the studies carefully and compare them to the saline control injections, they got enough of improvement to get approved as a drug, but it's not a dramatic result for most people compared to placebo. So my analysis is that sucks. We really have to be able to do better with headache. We need to understand them. We need to figure out what's causing them so we can decide what to do to make them go away. So this was one of my best teachers. This was Ranger, a dog we had when I had a horse farm in Minnesota. And he was a very kind, gentle soul and so patient. Every time there'd be a litter of kitties, they would all snuggle up with him. And he would just wait until they were done taking their naps to get up. And so that was kind of the approach I took with my migraine patients. I would be there with them. I would always try to give them new medicines and new things to try. I'd be present for them, and I'd just be patient and try to wait out the headaches. But in the back of my mind, I thought, there's got to be more than we can do for these folks. So my wife did Andrew Weil's program in integrative medicine and board certified in that. I had done enough mind-body work and other things with herbs to get board certified in integrative medicine. We both studied with the Institute for Functional Medicine and got functional medicine certified. And so both of these look for the root causes of conditions rather than just trying to treat the symptoms. They're more holistic, and functional medicine is also more biochemical and genetic based to really look for precision answers on a personal level. So I became obsessed with finding treatable root causes of migraine. I didn't just want to suppress the symptoms, and 50% response wasn't good enough for me. If somebody got half better, they might have been dramatically helpful. If you have a headache 30 days a month and you go down to 15 days a month, you go, wow, that's great. But I think real success is not just treating the symptoms, but to make them go away so that you might have the underlying tendency. Once in a while you break through, but mostly you don't have headaches anymore. It's something that you used to have. So I ordered lab tests on patients with migraine that people said, well, that's really not part of the standard of care of migraine. It's like, why are you doing that? I raised eyebrows. People go, I don't know if you should really be doing that. At my annual reviews with my department chairs, they'd show me the statistics on how many tests I ordered compared to my colleagues. They never yelled at me and told me I couldn't, but there were some implications like, okay, you're ordering a bunch of tests. I said, yeah, but my people are ending up in the ER and the hospital less. And they went, yeah, okay, that's good. What I found out is that I was finding all sorts of treatable stuff that was fixable. So thyroid problems in 13-year-old girls, celiac disease in people who had migraine for 20 or 30 years, vitamin B12 deficiency in vegans and gastric bypass patients, vitamin D deficiency in my own children who lived in the basement. It turns out that the light given off by the video screen when you're playing video games is not enough to actually make vitamin D. You have to go out in the sunshine. So iron deficiency in runners and in women with heavy cycles and people who don't eat meat. And so I found all of these things in doing evaluation for migraines. And the cool thing was that when I implemented these things and either I or their referring doctors treated those problems that I found, lots of times their headaches resolved completely. Zip, nada, none, no more, not again. That kind of completely. And that also happened with my own headaches, is that after I studied functional and integrative medicine, I did a bunch of testing, and I was able to find my own root causes and apply these things to me beyond just the traditional medicines. And I had the same experience. After a few months, my headaches went away, and I was taking some supplements as well as doing mind body work and things, and I was able to taper off of those and still stay headache free. So I finally had something really unique. I could finally get to the root cause, and when my partners sent me complex headache patients, I was excited. It's like, oh, great, let's see if we can help this person. Whereas lots of folks see a headache patient on their schedule and they think, I think I have to go home, or maybe I need a long lunch. But I like working with headache patients, one, because I identify with them and that resonates with me, but two, because if you're patient and you work on the details, you can really change somebody's life for the positive. So after having those successes, I spent the next few years figuring out a model and a system that could be replicated so patients could teach themselves things that would support their nervous system and stabilize it so they weren't firing off their migraine triggers all the time. So I identified different patterns based on function. These were definitions based on what worked to get people better. So in some areas, they're entirely different than the way neurology and the Headache Society defines the headaches, because they're clusters of symptoms that I was able to put in sort of pattern recognition processes in my clinical experience and find subtypes that responded to different types of treatment. So this was the culmination of my 2 decades of discovery and work with all sorts of kind and interesting and patient folks. And it led me to say, I finally have something that will help address what's causing your headaches for a lot of people, rather than just being able to treat the symptoms. So let's talk about subtypes. We need to think about subtypes on 3 levels. First, there's the major subtypes. Then there's the root cause subtypes, which are the ones that we have specifically coined in our program because they're the ones that worked in my practice. And then there's what I call secondary overlay. Some factors that if you don't address them, even if you have everything else right, you're going to stay in chronic daily headache land and you're not going to get out of there. So the major types are things that are recognized by the International Headache Society's classification of headache disorders. They include migraine with aura and migraine without aura. Both of these have a significant genetic component. About 70% of people with migraine have a family member with that. And then that 70-30 split also works for with and without aura. About 30% of people have aura and about 70% of people don't. So aura is a combination of symptoms that we'll get into more specifically, but there are things that happen at the onset of the headache during the first hour before or the first hour of the headache, and then usually they go away by the time you're an hour into the headache. These patients are different than the patients without aura in terms of it almost acts like a different disease. They're younger people. They often will get headaches as kids, boys before girls, usually 6 to 9, girls maybe 8 to 10 or 11. Girls get it before their cycles, and these people have more risk. So there's no more comorbid conditions. You're more likely to have restless leg syndrome and asthma and irritable bowel, as well as psychiatric conditions like depression and anxiety and panic and bipolar. And the migraine with aura doesn't seem to relate much to women's cycles or hormonal factors. It just goes on its own schedule and its own clock. It's not related to menstrual cycles or times of life when hormones go up and down. Whereas the migraine without aura, the more frequent one, people get that. Women often get it when their cycles start or within a few years of there, men later, often in the late teens or early 20s. And that's the one that's more likely to be associated with hormonal fluctuations, especially in women, changes in estrogen. So we're going to talk about the root cause subtypes. If you've taken your headache subtype quiz, you'll recognize these. If you didn't screenshot this or save a copy, you can contact our support team and they'll be able to send you that. We don't save any of the answers to the questions you gave us. We only save the outcome from our algorithm. And so These are algorithmic things that say which headache subtypes are most likely. It's not a diagnosis. It just gets you in the realm of what to think about when you're working with your doctor to say what kinds of factors should we address with your doctor or your provider. So these are the main subtypes. And then the secondary overlay, the main factor that we think is additionally critical to look into is rebound headaches. Those have since been named in official headache literature, MOU, or medication overuse headaches, and they happen with all sorts of things. The magic number is 9. Usually if you're using acute medicines more than 9 days a month, you're at risk for rebound headaches. Now, if you're using something like narcotics or Fiorinol or Fioricet or things that have butalbital, as little as 3 days a month of those can cause rebounds. Whereas things like acetaminophen and ibuprofen, often you need 10 or 15 days a month to cause rebound. But the problem is if you are overusing simple analgesics or prescription medicines, your headaches can get to be chronic and they lose the migraine features. So they don't have the throbbing or the pounding, or they're just a dull all over headache. Well, that's bad enough, but the really bad part is that acute medicines stop working and preventive medicines stop working. So you just have a headache that's there all the time that becomes resistant to all the treatments. So you have to get the medication overuse piece out of the way. So I'd like you to meet Lizette, and all the patients that we mentioned here are folks that we've known who've given us their permission to share their cases, or the majority of their cases that we've modified slightly, so that they would be able to share with you the success that they've had in our approach to migraines. So Lizette was a high-stress nursing supervisor. She would have headaches that would usually start around one eye, but sometimes the other eye. They'd last from 24 to 48 hours. They'd be pounding. She'd have a lot of nausea and vomiting. Some people just have a little nausea. They go, yeah, I have a little nausea. Some people throw up for 3 hours at the beginning of their headache, and that not only makes them feel bad, it makes them dehydrated, which worsens their headache. She had an unusual headache pattern. She'd have migraines every other day for about a month, and then she'd go 5 or 6 weeks without headaches at all. They weren't related to her cycle, and she went from doctor to doctor, and they told her either we can give you something to take when you get the headaches, or we can put you through a series of preventive medicines and see if we can find one that works. And she did that, and none of those approaches really worked for her. So her subtypes through the quiz and through our analysis were adrenal, so she had stress with her cortisol hormones, and then she had an underlying migraine without aura type. So those were her 2 main subtypes. So this was her pattern that came out on the testing. We did a lot of things for her. We came up with specific stress reduction. We used devices for meditation. We used targeted nutritional supplements for her headache subtype. So a lot of times people say, oh, I've tried supplements. And I've heard even supplement manufacturers I work with, they say, yeah, we want to get a supplement that'll help all migraine patients. It's like, well, we are more focused on finding diet and exercise and mind-body work, as well as supplements that are targeted to your specific type, rather than, here, you have migraine, take this. So she got 30% better. She was grateful, but for me, that wasn't enough. So we went ahead and did further functional medicine testing. We did IgG food sensitivity testing, and it turned out that she was allergic. She had food sensitivities on an IgG basis to corn and soy. And when she eliminated those, her headaches went away essentially completely. Now, the fascinating part was we were able to, in a Sherlock Holmes type fashion, figure out why she was having headaches every other day for a month, and then why they go away. Because she was busy and stressed and taking care of her family. And so her mother, who lived in a nearby town, about every other month would come over and stock her freezer with casseroles that had corn and beans in them, because that was part of their family recipes. And so she'd eat those and get headaches. And then when she ran out, her headaches would get better. But it turned out it was actually simpler just to avoid those and change the casserole recipes. So when we're looking at subtypes, it's like peeling an onion. We have to start with what's the most predominant subtype. And then when we treat that, sometimes just treating the chronic pain and getting the level down makes everything else go away. But more often, we are then left with a different set of symptoms, and then we reclassify the headache and go after those pieces. So one of the functional medicine phrases I like is, if you were walking around with 2 tacks in your shoe, do you think that taking out one of the tacks would make you feel 50% better? Because every time you step, you're still stepping on a tack. So we found that lots of times you need to address 2 or 3 different subtypes to really get the level of resolution that we're looking for headaches. So migraine is a threshold disorder, which means that the nervous system is wired with things that both excite it and things that calm it down. So the excitatory things are neurotransmitters like glutamine, and glutamine is the thing that makes the nervous system hyped up, and it pushes it closer to the firing thresholds where you're going to fire off things like a migraine mechanism if you have that underlying genetics and wiring. And then GABA and some other neurotransmitters calm things down and balance that. So the factors that go into this, there's the underlying genetics. Like we said, about 70% of people have some who have migraine have some genetic component with close family members. There is systemic and neuroinflammation. If you have inflammation in your body, we first discovered that your headaches are more likely to become chronic, and then we discovered you're actually more likely to get migraines in the first place. Then there are metabolic issues, often related to insulin and sugar metabolism. And then there are the specific root cause subtypes that you have. So if you're living down in the green zone, you can take a lot of hits. You might be able to drink a whole bottle of red wine. You might get a hangover, but you wouldn't get a migraine. If you're living in the yellow zone, maybe you go out and you get dehydrated when you exercise. Maybe it's too hot. Maybe you miss a night of sleep. And then you pop over into the red zone and you start having headaches. When you get into chronic headaches, a lot of times you're living in the red zone and half the days or more, you're having headaches. You've flipped over into having chronic migraines. And so by identifying the root cause subtypes and using an overall holistic approach that helps your metabolism and that helps decrease inflammation in your body, we're able to take away those layers and get you further and further away from the area where your migraines fire off all the time. And a lot of people have confusion between the things that trigger their migraine and the things that cause their migraine. So let's say I'm living right at the edge of that red zone and I eat some chocolate and I get a headache. And I go, oh, chocolate causes headaches. It's like, no, it's your underlying subtypes that put you at the edge there. And that chocolate is just what pushed you over the edge. It's not the real cause. That's a trigger, not a root cause. So let's dig in and look at the different root cause subtypes. So there's the post-traumatic headache. We define this differently for our practice and our protocols because we're only looking at post-traumatic migraines. There are separate kinds of post-traumatic headaches that happen to people who've had serious head injuries that are not related to migraine, and those are a broader definition that the headache societies use. But for migraine patients, we say it brings out an underlying problem. So we find that people with migraine genetics, like their mother, their father, their sister, their aunt had migraines and they never have. They get in a car accident, they start playing football, they get banged around a lot, they're playing soccer, they're heading the ball all the time. They may start to get a pattern of migraines, and that after that injury, especially an acute one, they may have headaches for 6 to 18 to 24 months before they calm down. So acute and repeated severe insults will do it, but so can chronic repeated head trauma, like what football players get on the line, or what boxers get by getting punched all the time, or what people heading the ball in soccer get. And those repeated head traumas, as well as adding some acute ones in, give you a risk of CTE, or chronic traumatic encephalopathy. And that's what we're hearing about boxers get. It leads to dementia and all sorts of other complex problems and behavioral changes. And some of the genetics that lead to these risks are parallel, are the same. Then there's the facial subtype of headaches. And the facial subtype has many fixable causes. Dental problems, including abscesses, TMJ, or temporomandibular joint dysfunction, grinding or clenching your jaw either daytime or more commonly at nighttime, sinus problems, and not just sinus infections, but also nasal allergies, sinus congestion, nasal polyps, things that come from food sensitivities and allergies and reactions can be big triggers, and they're very fixable. Then the other critical, interesting thing is the trigeminal nerve. So the trigeminal nerve has 3 branches, one that goes to the forehead, one that goes to the cheek, and one that goes to the jaw. And so if you get migraine headaches in one of those branches, you'll think, oh, I have a sinus infection, or, oh, there must be something wrong with my tooth. And for years, people would call their ENT doctor and say, oh, I got another sinus infection again. I seem to be getting like 2 a month. And they take antibiotics, and within 3 days or so, if you have the right antibiotic with a sinus infection, it starts to get better. Well, migraines last 48 to 72 hours. And so they would be getting better from their migraine. So then some of my colleagues at Mayo did research, and they found out that some of these people had migraines. As a matter of fact, a lot of them did. So their CAT scans and their MRIs and their scope tests in their nose to look for pus, all those were negative, and they responded to migraine medicines. So the ENT doctors started doing a CAT scan. It was negative. They said, well, it's not sinus. Go see a headache doctor. Go see your regular doctor. We don't want to see you. Well, it's actually probably more complex than that, because if the nuances, if you study the nuances, you can see that these sinus things can trigger the migraines, and then migraines can have symptoms in that area. And so we have to tease out which one of these things you're dealing with. Then there's structural headaches, and this is again a divergent area where we define structural headaches different than the neurology headache literature. They would say if you have an aneurysm or if the bottom of your brainstem is trying to push through to the area where your spinal cord's supposed to be, those are structural headaches, and they are indeed. But the structural headaches that we define in terms of functional groupings of things that get better and things that we have specific treatments are people who have back of the head headaches. They have a lot of neck and shoulder tension. That tension builds up, and then it has a lot of inputs from the 2nd to the 7th cervical vertebrae. So from C2 to C7, there's a lot of nerve fibers that go into the brainstem, and there's an area there called the spinal trigeminal nucleus that fires off and triggers migraines. And so if you have chronic tension and chronic pain in the neck, it sends signals that push that migraine trigger closer and closer to firing. Then there are several different hormone subtypes. There's the thyroid subtype, and that mostly we see in women with Hashimoto's hypothyroidism. It can also be in hyperthyroidism, but women have 18% of women have migraines and 6% of men, and women have 3 times as much autoimmune disease as men. So Hashimoto's is a condition where you're forming antibodies against your thyroid and trying to destroy that. And so we've also found that there are some root cause treatments that will help the Hashimoto's that will also help migraine. The thyroid is upstream from sex steroids, and so dysfunction at the level of thyroid can make your cycles irregular, and that can mess with your headaches as well. Symptoms of hypothyroidism: being cold all the time, dry skin, irregular cycles, weight gain, slow heart rate, constipation when it's full blown. But there's lots of people walking around out there with low levels of hypothyroidism that may be enough to contribute to their headaches that don't know it and would never find out without doing blood testing or other analysis. Then there's adrenal base. When we look at the answers from the questionnaire, we see this is one of the most common ones to come up. And I think that's because in our society, a lot of us are exhausted. People used to say, "Oh, are you burning the candle at both ends?" I go, "I've been burning it at both ends for a long time. I'm burning it in the middle." It's like, and I was proud of that. And so it turns out that's actually not something to be proud of. It's better to be in balance because your adrenal hormone is critical for life and death. If you don't have enough of it from minute to minute and you get an injury or a heart attack or go through a major surgery, you can die. And so the body has this thing called the cortisol steal, is if you're about to run out of cortisol or your body is high stressed and it thinks it needs more, it'll take the precursors that it was going to use to make estrogen and progesterone and testosterone and other critical substances, and it'll make them into cortisol because it figures, hey, if I'm not alive a minute from now, it doesn't matter if I add another family member a year from now. It matters whether I survive on a moment-to-moment basis. So stress levels can affect that. If your cortisol is too high, you have day-night sleep cycle irregularities. It messes up other hormone cycles. And it's inverse with melatonin. When your cortisol goes up, your melatonin goes down. When your melatonin goes up at night, your cortisol is supposed to go down. So if your cortisol is staying high all the time, it messes up things in all sorts of systems. It interferes with the integrity of the gut barrier. It changes the microbiome, the bacteria in your gut. And sustained levels of high cortisol can shrink the hippocampus in your brain, which is an area that's important for the incorporation of short-term memories. So we think it's important to recognize adrenal issues and to deal with them. Then lots of women will have issues with reproductive hormones, and usually that's almost entirely focused on estrogen. Progesterone plays a role, but it's minor compared to estrogen. So at mid-cycle, estrogen levels dip a little bit. People with bad migraines, especially non-aura migraines that are hormone sensitive, they might get a migraine at mid-cycle for a day or two. But they really get their big hormone headaches with their cycle, either the day before or usually the day of. It might last 3, 5, even 7 days. Other times when estrogen levels change significantly, sometimes they'll go away completely. Headaches will go away completely during pregnancy, or they'll be stable during pregnancy and then get terrible after the baby's delivered. And that also happens around the time of perimenopause and early menopause. When estrogen levels fall, the brain doesn't like it, and people get all sorts of bad, hard-to-treat headaches that will eventually resolve after menopause is stabilized, but it may take a long time to do that. And then there's hormones related to glucotoxicity or sugar, and there are 2 different versions of that. I'd like you to meet Barbara. Barbara is a calm, cool, collected yoga teacher. She always tries to do the right thing. For breakfast, she eats a homemade granola. Mid-morning, she feels a little bit edgy and just not quite right, doesn't have any energy. She always has chai latte. She loves chai latte. I kind of love chai latte myself, but I haven't had one for a while. And lunch, she'll have a green smoothie because this is extra healthy. And then by late afternoon, most days she's got a migraine. So what does she reach for? She reaches for a regular Coke because that sugar boost and the caffeine in it usually helps her headaches. Lots of evenings, she skips dinner because she's still nauseated or exhausted from the migraine and doesn't really feel like making dinner. Just what's called migraine post-stroke. So even if the headache is better, she's got this dull residual pain and like a hangover effect. So we can do some functional medicine testing looking to see if sugars are too low. There's some indicators on regular lab tests. If we interpret them in different ways, that'll give us patterns if your sugar metabolism is insufficient and you're running your sugar too low, not frank hypoglycemia like you'd get from an insulin secreting tumor, but more just running on the low edge of normal where it's not optimal for function, especially brain function in some people. So this is the cycle that Barbara was in. She'd eat her granola, her sugar would go up, and then you see that bomb? That's the insulin. So when the sugar goes way up, you secrete a lot of insulin, which drives your sugar down. Now, when your sugar goes down again, what happens? You feel bad, shaky, weak, edgy, and so you have a chai latte. Well, go to some fancy coffee store and look up how many grams of sugar are in a chai latte. I will guarantee you it's not 1 or 2. And then the same thing happens with the chai latte. Spikes your sugar, spikes your insulin level, drives it down. By lunch, you're starving. You have a big green smoothie. Probably put some bananas and some berries and other things in there because you want it to taste sweet enough to eat. And then it goes up again. Your insulin goes up again. And then late afternoon, you take the Coke treatment. Coke does help your headache, but it drives the insulin up again. You skip dinner and not quite the same thing happens because it doesn't spike right away, but your body does need sugar for brain function, for heart function, for kidney function in the cells. And so it cranks up your cortisol level. And if you don't get enough from that, you might even spike your adrenaline in the middle of the night, wake up with a pounding heart rate and sweaty and stuff like that because your body is doing everything it can to keep your blood sugar in a range that'll keep you alive. So glucotoxicity, if your sugars are too high, it can lead to insulin resistance. That's metabolic syndrome that ties into systemic inflammation. And then headaches become more chronic and migraines become more common. Also relates to things like neurodegeneration and Alzheimer's risk downstream. Sugar is getting too low in the functionally low range, but not the actual lab low range. Some people who are susceptible will get more frequent headaches, especially late in the afternoon, late morning, or sometimes even overnight. Then there are environmental toxicity types. There's toxicity from heavy metals, from molds, and then organotoxins, whether they're plastics or whether they're compounds like phthalates in cosmetics, or whether they are more the herbicide, pesticide things that we get from our food and water. Then there are the 2 primary types. There's primary migraine with or without aura. The primary migraine without aura is the one that 70% of people have. We talked about the onset of that, and here's the characteristics you have that differentiates migraine from a tension headache or a stress headache or a cluster headache or something else. Is you need two of the criteria from the top one. It has to be worse with exercise, and some of my patients say, well, I never exercise. We go, when you walk up the stairs, is it worse? They go, oh yeah. It's one-sided headaches often. It's pounding as opposed to squeezing. It's moderately severe. And then you have to have nausea or vomiting or light and sound sensitivity. And if you have enough of those criteria, then you meet the diagnostic criteria for migraine. So migraine with aura requires those same characteristics, and there's a picture of the aura. Aura could be positive or negative. The positive are things like zigzag patterns or bright lights, and the negative are dark spots or loss of vision field. That's the most common type of aura. There's sensory aura, which is either numbness or tingling. There's linguistic aura, which is scary, where you get garbled speech that will go away, and it's not a stroke or anything. It's just a non-specific dysfunction that happens and goes away in the pattern of an aura. And then there's a more serious version called motor aura or hemiplegic migraine. That's an autosomal dominant genetic thing. It's more associated with stroke and other complications. And so that one's a more serious type of migraine. So we need to help you find your dominant subtype. Like I said, most people have 2 or 3. If you answer yes to everything, because sometimes you have a little of this and sometimes a little of that, you might have even more subtypes. What we need to do is have you figure out which is your main subtype. So go through your quiz, figure out the subtypes that were spit out by our algorithm, and say, okay, where are your headaches? Are they in the front of your head most of the time? Or are they in the back of your head most of the time? So you're not looking like, oh yeah, once I had a headache over on the left. You're looking about what are most of your headaches like? Well, most mornings I wake up with pain and tension in my jaw, and I have frontal headaches. Okay, well, that's a facial headache. Lots of days toward the end of the day, I have neck pain and tension, and by the end of the day, I've got a migraine and my neck is really stiff. Then that's a structural headache in our subtype classification. When are they? Are they always late afternoon? Are they always related to your cycle? And what brings them on? Is it extended computer work and using your shoulders? Is it when you skip meals or when you eat a lot of sugar that messes with your glucose metabolism? So try to answer those questions and go through and say, well, of these factors, which ones relate to my most disabling and the most frequent migraines I have? And that's how you pick out your predominant subtype. So after you get a handle on the most predominant one, then other manifestations may become clear or more dominant. You need to think about and target factors that relate to the remaining symptoms. Often when one part's better, but another persists, you won't even recall the first part because that's human nature. It's like, oh, I don't remember that. I just know it hurts here now and I've got headaches. What are you going to do about that? And so we're going to keep working on the different subtypes and give you empowerment to find ways to support your nervous system so it's more stable. So does that make sense to you? And can you see why some of the migraine things that you've had, some of the treatments that you've been through, really didn't have a chance of working on the root cause level to support things? Now, when you understand your subtypes, you can find a way to take the first steps and to move toward resolving your migraine. It's not a one-size-fits-all approach. It's a targeted, personal, precise approach that addresses the factors that stimulate your migraine. It's not like we came out with a new migraine drug at $6,000 a year. Everybody should try it because they've tried everything else. Well, that might work for a few people, but it works a lot better if you target your migraine situation. So I feel like I've been working on this program in a cave for 20 years. I'm like Yoda. I've been sitting there distilling this, looking for patterns related to what can help people. So migraine, difficult it is, help you we will. We really want to find things that will help you individually and take these things that we've learned and learn through suffering with ourselves and learn through working with patients that we care about over the years and help you get access to these tools so that you can work on your own headaches.
I love that. Oh my gosh. It made me think of Luke Skywalker, right? So if you think of yourself as Yoda, everyone on this talk tonight is Luke Skywalker, right? So what Dr. Sheeler has done is basically taking all of his amassed education and experience and kind of packaging it up like Yoda and sharing the secrets of the universe with Luke Skywalker. So it's great. This does remind me of the most important thing in the beginning of the talk, right? Which is if you're not focusing on the root cause, then what are you doing, right? You're masking your symptoms or just kind of hunting and pecking for the answer. So is that that's right, yeah? Exactly. So as we kind of continue through this, let's talk a little bit about, hopefully, everything you've learned. This was a tremendous amount of information. I do want to say the comments in the chat, we're a little distracted because they're great. Like, we're getting it. Everyone's seeing that there is a tremendous amount of information that's been distilled in here and organized. And hopefully what you're seeing for yourself is either based on the results of your quiz or based on the education that you're receiving tonight, you're seeing those connections and that they make sense for you. And so we've already kind of established the idea of why you showed up, right? Tired of living between your migraines, that period of time where you don't have a migraine that you can squeeze life in, as well as recognizing that medications are not the only answer. In fact, talking about feverfew, I just wanted to bring that back around again. That's one of the nutritional supplements, one of the herbs that, it's my understanding, can cause rebound. So, and what was shocking from the very beginning for me was I always thought of rebound as being caused by migraine medications, but the idea of analgesics, just a Tylenol or an aspirin or an Excedrin, are rebound headache promoters. So that was really incredible information. But also, I think everyone here can relate to the idea that you've shown up because you understand that you're not meant to live a life of this chronic migraine. And although your doctor means well, he or she probably haven't dedicated their careers to understanding the details behind migraine, right? And so they're doing the best they can, and they're trying to do research and go to headache meetings, but you'll never find this information at a headache meeting. There's bits and pieces of it that are discussed, but in general, it's not all put together. The pieces haven't all been found. And so we are excited because it's time for someone in the medical community to actually stand up and pull the curtain back, right? So the mystery of what's happening in a doctor's office or in your doctor's mind, that's the way medicine used to be practiced. But today, the goal is to give the control to the patient. It's to make the Luke Skywalker. I love that. So it's really to enable you to chart your own path and your own course under the direction of someone that's kind of put all of their secrets and mysteries all together in one place, right? And so the obvious question is how, right? How do you learn the actions that you need to take that are specific to your custom connection of subtypes so that you can finally achieve that kind of success with your migraines? And so the obvious answer to that question, as we've discussed a few times, is you can take a precision approach. You can look at your root causes, your subtypes, and understand with laser focus how to navigate all the things that we already inherently know, all of those wonderful things that we listed in the very, very beginning that told us these are the things that we've tried, and some of them work for some people I know, and some of them work for me. But the laser focus on taking that precision approach is what matters and that we're capable of doing. Option 2 is to continue to say, oh, well, my cousin got success with magnesium, so I'm going to try magnesium. And oh, it works for a month, then it stops working. Or, interestingly enough, magnesium can cause a rebound in some people. So there's just some interesting, or at least kick off a migraine. It could be a trigger. So the idea of two sides of the coin, which one do you take, becomes the challenge. But here's what we know about medicine, right? Do we solve it or do we suppress it? And unfortunately, I believe the medical establishment largely, not completely, but largely is set up to suppress because there's just not enough time to solve. We probably can all agree with the idea that when it comes to chronic conditions, they're complex. You saw all the layers of migraine and all of those different subtypes that contribute. And even within a subtype, all of those other, like if I look at facial, all the bullet points that are different. It could be sinus, it could be trigeminal, it could be allergies or sensitivities. So there are just so many factors at play. And to tease through all of that requires a deep investigation, and it requires a custom approach. And so if you think about it, that's not the way our medical establishment is set up today. So we sat down around a table and thought, how do we bring this solution and make the patient the hero? How do we educate and reinforce everything that needs to be reinforced? There's nutrition. And if we open up that list of chat, all the things everyone has tried fit into these categories: nutrition, lifestyle changes, maybe laboratory testing, mind-body approaches, the sense of community and understanding and learning from one another, right? And then pattern recognition and deep, deep education. We always say in clinical practice, if you don't explain why, then it's so difficult to motivate anyone to make a change because they don't understand the why. And if you have children, you understand this, right? Because from the time they're 2 till the time they're 6, everything is answered with why. So it's the idea of we're asking a chronic condition. We're asking ourselves to make changes to reverse a chronic condition. But in order to do that, we really need to know why these things matter. And so with that, I want to introduce you to the solution. When we framed what a solution would look like, it encompasses all of those components. So with Dr. Sheeler at the helm, we were able to build a comprehensive program. It is guided by Dr. Sheeler every step of the way. It's completely online, although there's a kit that's delivered to you as well. That sole purpose is to identify these root causes, walk you through step by step so that you become, to use that same analogy, so that you become the Luke Skywalker and take it forward so that you can address the root causes of your own migraines. And so the program itself is 8 weeks. And if you were able to engage and actually all of those factors, that multifaceted approach, you were able to learn about them, make those changes, and dig in with them, it's 8 weeks could result in really a lifetime of difference. And so that's really what we're talking about tonight. So I want you to meet Danielle. She's an actual student of the program. If you want to tell us about Danielle, Dr. Sheeler, that'd be great.
Sure. So Danielle came to us having had many years of migraines. She's a single mom of 3. She got up at 4 every morning because she had a 90-minute commute each way, and she was having 3 or 4 migraines every week. Her subtypes were facial, adrenal, structural, and glycotoxic. And when we looked into her situation, there was the pattern of her headaches that came up on her quiz. A few people have said that they just wrote down the letters or don't have that. And so if you didn't get the results from your quiz in a way that you captured them and you need them, you just contact our support team in chat and they'll track them down and send them to you. And like we said, we don't keep the answers to your questions. We just keep the output from your
code.
algorithm.
Mm-hmm.
And so Danielle, after she went through the program in the last 5 months, instead of having 3 to 4 migraines a week, she said she's only had 3 migraines in the last 5 months. And if you do the math, that translates to she was having 120 migraines every year, or 4 months out of the year she was living with migraine. And so in my practice, one of the most rewarding things is when people do this, they feel like they have their life back. I've had people say, wow, now I want to go to graduate school. Wow, I want to start having a relationship. Before I would just go home every day and try to eat something and go to bed. And now I feel with my life back, there's a lot of things that I want to do while I'm here on the planet.
Mm-hmm. And Danielle is one of many, many, many. We just didn't have enough time to fit them all in. We could talk about these kinds of results that we see over and over again. So I want to put the URL on here, DestinyWellMigraineSolution.com. Dr. Sheeler mentioned if you want to hone in on your results, or maybe you didn't get the opportunity to interpret them, you didn't get the image, go ahead and go to that website. There's a little chat button that pops up on the bottom, and you can go ahead and plug in, let them know that you didn't get your results and give them your email, and they can look up the actual code that goes with your results. So the program itself has 9 modules, completely online. There are 70 videos with over 7 hours of this deep kind of content that is just slowly released week after week so that you're able to get your arms around it and really take it in. So it starts with planning and understanding all the details about migraine, and then dives into root causes and triggers in the next module, where we dive in and separate the difference between root causes and triggers and understanding about rebounds and refractory periods and hangovers. Then this talk about subtypes was just scratching the surface. There's even deeper discussions about each migraine subtype. We go into the details about medications. Medications are for many a necessary evil. Lots of people manage without them. But there's a guide in here that you can work with your doctor on with powerful combinations that get more instant relief or tend to work better in certain patients with certain subtypes that Dr. Sheeler shares within the program. At the same time in there, we talk about natural remedies. We talk about nutritional supplements, because various subtypes have nutritional requirements. And so supplementation isn't a long-term answer, but very often it can be the short-term answer that fills up those empty buckets and allows all the biochemistry in your body to function the appropriate way. Then we move into the migraine solution diet, which is not just about eliminating, right? Very often people with migraines, they've been through eliminating gluten and dairy and get frustrated with that. And if you do it one at a time, it sometimes doesn't really give you the answers you need. But we talk here about adding things back into your diet too, as well as things like caffeine and foods and alcohol and things like that. We go deeper into the science behind making changes in your life and making those changes stick. And stress and sleep. We all talk about stress and sleep, and it's not just about getting more sleep and about having less stress. It's about managing things better. It's about interpreting things differently, and it's about getting quality sleep, not even just quantity, right? And then there's an exercise component, which is finding that perfect set point where it's not too much and not too little exercise to get relief without overdoing it. And then we pull it all together at the end. So in this program that is completely online, you have access to the program forever. It's unlimited access to all of those videos that I talked about, plus a 50-page nutrition plan ebook specific to the migraine solution. We include, I said it was comprehensive, all those little arrows. We include an at-home lab testing kit. So you just prick your finger, a couple drops of blood, and these are the 5 most valuable tests that can be done at home so that you understand about your migraines. And then when your results come in, Dr. Sheeler does a live interpretation of those results for everyone on the program. So you have your results in hand, and he goes live and discusses what it means and what those implications are. The program also includes, once you've honed in on your dominant subtype, it includes your first month of nutritional supplements. So that's a part of the program so that it's all geared toward hitting all of those arrows that matter. It also includes menu plans, shopping list, migraine solution diet, compliant recipes, everything you'll need to get started. So I just want you to remember, this is not theory. This is a program that's in place today, but it's also the very same thing that Dr. Sheeler does within his own office in Scottsdale, Arizona. So I suppose, I don't want to put him on the spot, but I suppose you could fly to Scottsdale. It could be kind of expensive to do that, but this is a proven methodology. This is the culmination of his career in migraine. This is what the modules look like. There are 9 of them, and they're each about 10 different lessons within them. And it's not just about the education. It's about combining the results of your labs, understanding how you can improve, understanding what nutritional deficiencies you might have or what support would benefit your specific combination of subtypes. It's understanding the role of medications and your diet. And then we've added extra bonuses into the program. So Dr. Angela O'Neill, who is our Chief Clinical Officer, who's also participated in Andrew Weil's integrative certification at the University of Arizona, has formulated for us an organic aromatherapy combination. One is for nausea, which is an inhaler, and the other is a roller ball for the pain and discomfort of migraines. We also include blue blocking glasses, which have an implication with sleep and melatonin. So we see huge successes with that as well. And then to touch on that idea of community, we have created the Migraine Insiders Club. And so this is a members-only organization, a members-only Facebook group where access to it is just for migraine solution students. And so once you're in, Dr. Bob goes live every week. And on the weeks that he doesn't go live, we've got registered dietitians that go live, behavior change experts, exercise experts. But Dr. Bob goes live at least 6 times within your 8 weeks of your sessions. So imagine, okay, having access to a Mayo Clinic migraine expert for 6 hours to ask questions that relate specifically to your healing your migraine based on a root cause approach.
So there are lots of things that come in the box, and I'm one of them.
And he's one of them. But more importantly, there's a sense of community in there. So you're amongst other migraine folks and sharing uplifting stories and talking about subtypes and how they're changing what you're doing and how you're living. And so you're probably, obviously, since you're still here and you're interested in reversing your migraines, wondering, how much is this going to cost, right? So what's the investment? I know. But really, I just want to say, when we sat down around that table to put this together, all the ideas we threw into it puts the price at a very high point. The value of this program, honestly, including lab kits and supplements and having access to a migraine expert, is around over $5,000. And so that is certainly not what we're charging. And so we tried to really make it affordable for folks and started with just an investment of $299 today. And then you can have just 3 simple installments after that of another $299. So just 4 installments, or if you choose, you can just do a single payment of $997. It saves $199, but you'll see that no matter which option you were to choose, you have the same exact access. It doesn't matter at all. So the URL is at the bottom if you want to go to the website and take a look. I don't want to stop anyone from moving on, but if you'd like to go to the website, check it out. There's a chat box there. You can talk to folks on chat, but I want to get to that special bonus as well, because I talked about there being a fast action bonus. So once you complete your registration, if you're interested and you get started, you look at all the value added up. As I said, it's over $5,000 with the migraine solution in and of itself as a program. The lab kit, if you go to our website today, it sells for $119. The supplements average about $108 a month. The instant access to the Migraine Insiders Club with visits with Dr. Sheeler, 6 hours of his time. But the other thing is you have access to this community forever. So you never have to leave. You'll always be learning from Dr. Sheeler. If something else pops up, you can jump in and ask another question. The aromatherapy, the glasses, and we have that special offer. That special offer is the food sensitivity testing kit. So we actually have, it's $199 value. We sell that on our website today. It's a food sensitivity IgG testing for 96 different food sensitivities. You will have access to that actual kit free of charge. It's included completely, but only if you order within an hour of this program. So these are the simplest ways to get started. And I just want to reiterate, everything is included. And I want to go back to that idea of, if you're not addressing the root cause, what are you doing? The hunting and the pecking and the, shooting in the dark. And so right now we probably have tons of questions. So why don't we just shift over and I'll go ahead and open up and answer some questions. So if you have any questions, by all means, please jump in and put them in. So some of these questions were answered throughout.
Right. I saw a couple of questions I want to dive in and answer that I got along the way.
Great.
So we just got a question from someone in Canada about international programs, and there are some things we can ship internationally and some that we can't, and so it is actually more economical because there are a few pieces that you'll have to put together from your side. So the equation comes out for Europe and Canada and South America to be a different equation, and we have a separate web link for that.
Actually, just go to this DestinyWellMigraineSolution.com if you're outside of the U.S. and just let them know on chat that you're outside of the U.S. and they have a link if you're interested, and they can talk to you about the details of what you get and how it's different. It's not much different. We just can't ship the lab kits and the supplements, but the pricing is slightly different as well because of that.
Right, but it's still. in it's just in an American accent, but it's otherwise great information. So another question is, someone said every time they drink alcohol, they get a headache. Is that a root cause? That's not necessarily a root cause. That means that your individual susceptibility and where you're living on your migraine continuum is close enough that always pushes you over the edge. And so I used to get headache migraines from alcohol, and one of my children made me go to Europe with him this summer. And so he and his college buddies were used to imbibing certain amounts of alcohol, and so I tried to keep up with them. And although I might have gone to sleep early, I didn't get a migraine. And so once you get that root cause solved, then those migraines tend to go away, and you can drink and do those kinds of things that you haven't been able to do for a long time.
Because your threshold is going down, right?
Right, you're further away from the threshold. And so it might push you toward it, but it won't necessarily push you over it. You'll just be bouncing up and down in the green or yellow zone, but you won't get to where it pushes you into triggering the migraine. Mm-hmm. Another question came in about white matter lesions like seen in multiple sclerosis. And on MRI, people with migraine will often have nonspecific white matter lesions. Usually the pattern is somewhat different than in multiple sclerosis, and they can actually go away. And nobody's been able to figure out exactly what they are, but they do go along with the diagnosis of migraine, but they're somewhat different and they don't have as bad a prognosis as the ones in multiple sclerosis. Then another question that came up on both the last webinar and this one is, what about weather? Is there anything to do about that? And the answer is, number one, just moving you further away from the threshold. But in the program, there are some specific things that we do. There are some specific hacks and tricks we can teach you to make you less sensitive to the things that happen with weather changes. I also had a question about vestibular problems triggering migraine, and there's a separate process that we're working on for vestibular retraining that can be done at home that we can link you up with. And so a lot of these things, we have specific pathways to help.
So there is a question about someone's result, and they saw things that have X, TR, XA, XR. So I'll answer this person's question specifically because they wrote in. But so Wendy or Peter, when you look at that code, okay, circle the ones in your mind that don't have an X in front of them. So in your case, it's S and E. S stands for structural, and E stands for environmental toxicity. So you're able now to decode your root causes. Your root causes were structural and environmental toxicity. So I could go off on that because that's really interesting given your comment about alcohol. But that's wonderful. So in the course that Dr. Sheeler just walked through, remember structural and environmental toxicity. Oh, there's another one here. So again, someone named Martin, you've got TR, that's trauma. F, that's facial. A is adrenal. R stands for reproductive, but you have an X in front of that R. So that's not reproductive for you. S for structural. G for glucotoxicity. So Martin, you've got trauma, facial, adrenal, structural, and glucotoxicity. That is not uncommon, so don't feel bad. Great. Do you want to add? There's some others too. Someone just said, bingo, I realize mine are mostly structural. What's the best start? So the migraine solution.
Right, where we can help you to understand all the things that go into that structural. And structural was one of my main subtypes and one of the things that I was able to address through a number of different mechanisms. And so we can teach you what kind of chiropractic is good for that, what kinds of exercises are good for that, what kinds of supplements help that. And so we can give you both quick fix hacks as well as things to get longer term awareness. So for me, some of it was learning some specific mind-body techniques that helped me to learn to recognize tension before it got to the level of pain. Because by doing that, by becoming aware of it, I was able to get control of those muscles and that tension. So by the end of the day, I felt refreshed. I didn't have that tension that led to the headache in the first place. And then I'd walk out the door without a headache instead of be done with my workday having headache after headache after headache.
Mm-hmm. I see a lot of questions about a replay. We're close to the end now, but I do want you to know that we will send this out, a link to the recording in the event that you want to watch it again and take notes, because I know I've worked with Dr. Sheeler. I've tried to take notes with Dr. Sheeler. He's an amazing fountain of information. And so sometimes it would be nice to press pause and finish writing some things out and press play again. So we'll be sending that out for you. He does an amazing job of filling a small space with a lot of information. Imagine 70 videos and 7 hours of it.
And the good news is you're not one of my medical students, so you don't have to take a test at the end. You just have to find the information you want and gather it.
That's exactly right. Someone asked, is it possible to get both migraine without aura and migraine with aura headaches interchangeably?
Yes, it is possible. So some people say, well, sometimes I get aura and sometimes I don't. If you've had aura at least twice in your life, then your headaches are migraine with aura and you just don't get it very frequently. But I have seen some people that have the pattern of they have aura and then overlaid on that, they get headaches with their cycle that don't have aura. So it is possible to get both types. And it's also possible to have like migraine and clusters. So one of the units we go into, sort out all the different headache types you have in addition to migraine, so we can figure out what to do to make sure that you're getting the right care rather than we're just treating part of the problem.
Mm-hmm. So Corinne asked, how long do I have to take the quiz? The link to the quiz is good forever. We'll find that when students are in the migraine solution, they'll continuously go back and take the quiz and see if their migraine subtypes are changing as they continue to make different changes in their lifestyle or nutrition, nutritional supplementation, and things like that to see if they're addressing their root causes. So that's always up and always available. But if you want to make the most out of the actual discussion tonight, you should take the quiz whenever you can, as soon as you can. It's just there to help. Alexis did say she's so glad you said that because she does have aura, but she also has hormonal, and she always thought that they were the same. Mm-hmm. Mm-hmm. That's really common. Can migraines cause demyelinating areas of, oh, you've already addressed that one. That's great. Great. All right. Wonderful. Well, I want to thank everyone for hanging in there. Don't forget, if within an hour after this presentation, if you are interested in joining us on the other side in the Migraine Solution and the Facebook group, Migraine Insiders Club, once you purchase, feel free to request to join the Facebook group, Migraine Solution Insiders Club, and we'll let you in and we'll start the conversation. So you're always welcome to join us in there.
Right. We'd love to have you join us. We'd love to work with migraine patients. We feel that people with migraine headaches really don't get a fair shake, and a lot of people don't understand them. So coming someplace where we both understand and appreciate what you've been through, and we want to give you hope and tools to get to the other side, we'd love to see you and work with you in this process.
So someone said we went to the website, but there was no info on buying. So Sue, scroll to the very bottom of the website and you'll see 2 boxes that show the price options. Click on those and they'll lead you to the link. I'm so glad you said that. Maybe we need to make that more clear. But you can click on either one of the options to purchase. So they're actually buttons. So if you choose the button, quote unquote, that says payment plan, then you'll be taken to a checkout page that looked like the one I showed that's specific to the payment plan so that we charge you correctly. And then if you choose the one that's the one-time payment, you'll be taken to a checkout page that is the whole payment in there. So Jerry asked also before we sign off for good, you weren't able to download the quiz. So there's nothing to download. Just go back into the emails, Jerry, that you received that led you up to this webinar. We put the quiz link in every one of our emails. So go ahead and click through to the quiz. If you can't get that, go to DestinyWellMigraineSolution.com and let our support staff know. Ask them to send you a link to the quiz, and they'll do that for you as well. So wonderful. So with Dr. Bob and myself, we thank you so much gratitude, and we really wish you the best on your migraine journey, and we would love to see you on the other side. Have a great night.
Thank you.